I saw this update from a friend last week, and it really prompted me to make this infertility video. So it's just like a discussion, okay? Hi guys, welcome back to my YouTube channel. If this is your first time joining me here, I would like you to click the subscribe button down below and also click on the bell so that you can get notified each time I post a video. But if you are a returning subscriber, thank you very much for coming in here to listen to me today. It's your girl Favor here. Okay, today I'll be talking about infertility because sometime last week a friend posted something that really marveled me. He said that the uncle divorced his wife 3 months into marriage because she couldn't give him a child. Can you imagine that? I couldn't even imagine such a thing. I can't believe that in the world we live in today that women are still blamed for infertility in marriages. So I decided to make this video to enlighten you guys more about infertility. So what is infertility? Infertility is defined as the inability to conceive naturally after 1 year of uninterrupted sexual intercourse. So when I say uninterrupted sexual intercourse, it means you have to have sex with your partner every day, like almost every day, if not every day, say 5 days in a week, for a period of 1 year before you can be diagnosed of infertility. Infertility is not being able to conceive after 1 month of marriage. It's not being able to conceive after 2 or 3 months of marriage. You have to give it a period of 1 year before infertility can be diagnosed. I like to classify infertility into 4 broad categories. The first is primary infertility. Primary infertility is the type where the couple in question have no previous pregnancies, like the lady haven't conceived for the first time. Then secondary infertility is the second one. It's a situation where the lady has conceived previously but is unable to conceive even after a year with constant trial. Okay. The third is wasted pregnancy. In wasted pregnancy, the lady is able to conceive but unable to give birth a live child at the end of time. Okay. Then the fourth one is subfertility. Okay. In subfertility, there is a delay due to reduced fertility in both couple or just either of the partners. So now I'd like to talk about causes of infertility in male and in female. They are classified broadly into 3. Okay, both in male and female. Okay, now we'll talk about the causes of infertility in females, and it's broadly classified into three causes. It can be as a result of defective ovulation, as a result of defective transport of the ovum, or as a result of defective implantation. So now let me just explain about the defective ovulation. This defective ovulation, when there is a problem with production of healthy eggs, and this can be caused due to some endocrine disorders, like when there is a dysfunction in the hypothalamus and the pituitary gland. It can always lead to an excessive production of prolactin, which will prevent ovulation at all. So now the lady will not produce or drop any eggs. Other factors like ovarian cyst or physical disorders like obesity and excessive exercise can also affect the menstrual cycle of this woman, and in turn might lead to infertility. Now I'm going to discuss about defective transportation. In a normal case scenario, when an ovum is being released, it's been fertilized and transported through the fallopian tube into the uterus where it's then implanted. But in cases where there is trauma or any previous tubal surgery that has left a stricture on the tube, or where there is any sort of obstruction on the tube, there will be no smooth transportation of the ovum to the uterus, causing infertility. And then the third is defective implantation. In cases where the woman has a fibroid or any congenital anomaly, it may prevent a smooth implantation of the zygote, which can also result to infertility. So now I'll talk about the causes in men. Just like the causes in female are classified into three, I'll classify the causes in men into three also. So the first one will be defective spermatogenesis, the second one is defective transport, and the third one is defective delivery. So I'll go back to the first one to explain. In defective spermatogenesis, there are several factors that could contribute to the production of unhealthy or faulty sperm cells. For instance, when one has an endocrine disorder, such as diabetes mellitus or hyperthyroidism, this can lead to the formation of faulty sperm cells, which will not be able to fertilize matured eggs or ovum. Again, if you have undescended testicles or infections such as gonorrhea, chlamydia, the STI, it can also affect the sperm cells, causing infertility in men. Now, I'll talk about effective transportation of the sperm cells. So when these healthy sperm cells are being produced and there is an obstruction in the seminal vesicles, they are not mobilized, okay? They are not allowed to move out. So several things can cause this obstructions, such as infections, maybe a genetic defect or physical disability, okay, and the sperm cells are not released, okay, to move in and fertilize the eggs. This can also lead to infertility. One cause is defective delivery. So this could be due to psychosexual issues such as impotency, okay, ejaculatory dysfunctions, or other physical disabilities such as hypospadias, apispadias, and the rest of them. So when next you are around people that are having infertility problem, people that have been trying to conceive for over a period of 1 year, or you actually in that particular situation with your partner, it's not the responsibility of a woman alone to go seek for help, okay? Go to the hospital with her. You both should find out the cause of your issues and select the most adequate remedy for your problem. Okay, the treatments of infertility are actually based on the cause. Okay, if it's due to a particular infection, the infections are being treated and the woman can go ahead and conceive. But if it's due to any other physical problems, the physical problems can be tackled. Okay, now I'll dive right into the treatment modalities. So the treatment of infertility depends on the cause of the problem, on the duration of the problem, the age of both the parties, their preferences. It's your decision to choose the remedy you want to go with. Okay, so if it's an infection can get treated. If it's a physical disability, it can get worked on. If it's a physical problem like obesity, anorexia nervosa, there are some therapies that can be given to you, okay, to work on yourself, okay, to get better, and then you can conceive. But apart from that, there are other artificial methods. So there are the methods I'm going to talk about now. The first is intrauterine insemination. Sure. In intrauterine insemination, here healthy sperm cells are being collected from the man. We all know that the sperm cells can survive even for 72 hours, like 3 to 4 days they can survive, okay? So they are placed into the uterus right before ovulation, so that once the woman starts ovulating and the eggs are being transported there, they get fertilized and they are implanted. And the second one is the one we all know that is very popular, the IVF. Okay, the IVF is usually done in the laboratory. Here, a healthy sperm cell is collected from the man, and healthy eggs are collected from the woman. And they are being fertilized outside the womb. They are usually fertilized in the laboratory and then implanted into the woman's uterus. They are placed into the woman's uterus for implantation. And this one is mostly done for the couples that there are no cause to infertility. Some couples, they have infertility issues, but after running test upon test, there are no cause, there are no issues. Their sperms are healthy, their eggs are healthy, there are no infections. Okay, in this case, you can do this IVF. You fertilize the eggs and the sperm outside the womb, and then you implant it in the uterus. Sure. Next option is zygote intrafallopian transfer. In zygote intrafallopian transfer, a fertilized egg is being placed in the fallopian tube, which in turn transfers or moves down to the uterus to get implanted. And then there is gamete intrafallopian transfer. In this type, the healthy sperm cells and the eggs are being mixed, but without being fertilized. They are placed in the fallopian tube where they get fertilized and they move directly to be implanted in the uterus. The next option could be donor eggs or sperm. You all hear about sperm banks and or where donors can donate their healthy sperm cells or their healthy eggs. So if you're unable to produce a healthy sperm cell or your sperm cells are 40, you can go to a sperm bank, you pay for a sperm, okay, or you get a donor who can donate his sperm, and it can be injected into your wife, or your wife can also donate the egg. Or if both of you don't have healthy eggs and sperms, you can also get a donor for the egg and a donor for the sperm. The next option could be gestational carrier. This is the same thing as surrogacy, okay, and this is mostly used in a situation where the woman has no womb, or the woman has an issue with the womb that she can't keep the baby in her womb. She has a problem with her womb, or she has no womb at all. So here the healthy sperm cells and the eggs are collected from both parties, fertilized, and they're being put into a surrogate mother who will carry the pregnancy to term and then give birth to the baby for the couple for a paid token. Okay, so when you've tried all of these options and it hasn't worked out for you, like it has all failed, you can also opt for adoption, where you adopt a baby that someone else has already given birth to. Okay, a baby is a baby, a child is a child. Okay, it's God that gives children. Those ones are also children. So you can opt for adoption, pick up a baby of any age you want, and you raise them as your own. You show them the same love and the same care you would show to your own children. Okay, I think I've come to the end of my lesson, but I'd like to say one thing to you. You know, this infertility thing, we're talking about it so lightly, but it can have drastic effects on the life of couples. Okay, so that's why it's very, very important to maintain your reproductive health, you know, to constantly improve your reproductive health as a youngster, as a youth, or that you are. Okay, so in my next video I'll be talking about ways to improve your reproductive health. Okay, ways you can maintain and improve your reproductive health so that you won't have infertility issues in your nearest future, or you will avoid that, okay, in your nearest future. Okay, so watch out for my next video. I think this is the end of my lecture. As you can see, I didn't have any smiling face because I was talking about something serious. So my smiling face is back. Please, I would like you to comment on this video if you learned anything, if you have any question, if you have any suggestions, please put them in the comment box. Okay, I'll be there to answer all of your questions. I'll be there to accept all of your suggestions. If you've not liked this video yet, please do what to give us a thumbs up. If you've not subscribed to my channel, please do what to subscribe to my channel. I'll see you in my next video. Bye bye.